Welcome back to Cheddar's Opening Bell. Although the U.S. is ramping up its vaccination efforts, only 5 million Americans have reportedly gotten their first dose of the coronavirus vaccine. So that number means that about 70% of the 17 million vaccines that have already been distributed have not yet been administered. And joining us now is Dr. Maria Elena Bottazzi, Associate Dean of the National School of Tropical Medicine at Baylor College of Medicine. Dr. Bottazzi, how concerned are you about this snail's pace of a vaccine rollout here in the U.S.?
Thank you, Jill. Nice to be with you. Well, I think like everything, this is unprecedented as a pandemic. It's an unprecedented vaccination campaign that has to occur. So I think we indeed started a little sluggish, compounded by the fact that it was done also in the mix of the holidays, in the mix of many other things going on at the end of the year. I think we have optimism that now it's going to be ramped up. I think also the data may not necessarily, like you said, there's been 17 million doses of vaccines distributed. Now, how many vaccinations have happened have to coincide with all the records. So I think now we're going to start seeing a little bit more acceleration of this. So I'm optimistic.
How does the U.S. compare to other countries when it comes to administering this vaccine?
Well, first of all, I think as a U.S. Citizen, we have been quite lucky. As you know, there's many countries around the world that doesn't even have this problem yet of how to do the distribution. I think it goes side by side a little bit with the UK, with trying to ramp up the vaccination campaigns. I think the fact that we also had a little bit convoluted algorithm of who should be getting the vaccine first, how to deploy the vaccine, is also confusing a little bit the population. I think at this point we need to be much more forefront to who would like to receive the vaccination, should have the opportunity of receiving it. And therefore we have to really ramp up not only the locations where we have to provide these vaccinations, not only limited to healthcare facilities, but maybe even open up other venues.
So much emphasis was put on Operation Warp Speed in getting these vaccines approved and getting this emergency use authorization. It doesn't matter, though, if people aren't actually getting vaccinated. How frustrating is it? How key is vaccination, do you think, into controlling this pandemic?
I think it's a very key because as you see through this holiday season, we have seen yet another resurgence, quite a bad resurgence of cases. And I think it's going to be a combination of multiple approaches. As you know, we have to continue physically distancing. We have to continue using other methods like masking. But we need to now incorporate vaccinations, which, as you know, right now, the key is to reduce the clinical symptoms, meaning that people who get vaccinated ideally will reduce the burden of the disease and therefore not exaggerate the number of people that actually, of course, go to hospitals or even become severely ill. And as we increase these tools and as we increase the usage of vaccinations, I think by maybe, third quarter of next year, we're going to be slowly seeing a great improvement. But the key here is to continue reducing the virus that is circulating in our communities. And that can only be done combining these strategies.
Everybody is sort of wondering when things will get back to any semblance of normalcy. The thinking was that 2021 would be that year. You mentioned maybe by the third quarter. Is COVID and this pandemic, is it a 2021 story as well? You mentioned maybe third quarter. Are we going to be dealing with this and living this way where we don't see friends, where we're wearing masks? I'm the only person in this studio. You're home. I mean, is this going to be our lifestyle for how long, do you think?
Well, even though I am quite optimistic that we will be getting out of this situation and go back to some normality, maybe not the similar normality as before, but I think 2021 is still going to be a COVID year. And it's because we now have more and more tools, better tools. I think we're going to see rolling in also other vaccines, maybe even improving our health systems, not only to deploy these vaccinations, but at the same time also bringing in other strategies, including potentially advances in more diagnostics or even more treatments. But at the end of the day, it has to be adopted and it has to be used by our communities. And I think this is where we have to improve our communications, improve ensuring that the communities have trust in these techniques, whether it's by masking or by using vaccines. And it's going to take a while. Remember, we are 7+ billion people around the world. And even if we protect our US communities, we need to also be abreast that everywhere else, we also have to achieve the same goals so that we can then travel and transfer ourselves and do business as usual as we used to before 2019 ended.
How worried are you, about the new variants that we're seeing? They're already here in the U.S., but there's word that the variant that's spreading right now in South Africa, even potentially more contagious than that variant that originated in the U.K.
Well, I think as a virus, we know that it's going to diverge and we are going to probably see various variants arising. I think that's the reason why we believe vaccination is also very important. If we have many, many people vaccinated that therefore have a very robust immune response against the virus, we're going to probably squash the ability of this virus to take over. And that's one of the things that we need to do, right? Reducing the amount of virus circulating, not allowing it to continue looking for divergence and therefore new variants. So we are worried because, of course, we are still seeing so much virus circulating in our communities. But I think the key is the fact that if we all use combining these tools like masking, distancing, and now vaccinations, we are going to probably suppress this. So, cautiously worried, but we as scientists have to keep an eye on how these variants really are going to come and potentially influence this pandemic.
All right, Dr. Bottazzi, Associate Dean of the National School of Tropical Medicine at Baylor College of Medicine. Great to have you on this morning. Appreciate it.